Hi guys, my name is Milana Antonelli and I did my special education project on attention deficit hyperactive disorder. Many of you have probably heard the word ADHD thrown around. Lots of people use this word without having a real understanding of what it is. Attention deficit hyperactivity disorder, also known as ADHD, is one of the most common childhood disorders that can continue through adolescence and adulthood. Symptoms include difficulty staying focused, paying attention, difficulty controlling behavior, and hyperactivity. It is important to know that you are not alone if you have ADHD. An estimated 6.5 million children and adults are diagnosed with ADHD. If you have ADHD, you might be wondering what caused this. Were you born this way? Did you develop it at a young age? I have the answers for you. One theory researchers have is brain chemistry. Researchers hypothesize that ADHD is caused by an imbalance of two chemical messengers or neurotransmitters in the brain. Another theory is genetics. ADHD tends to run in families, considering to be a genetic trait. If you're a parent who has ADHD, there is a high chance your child will follow in those footsteps. Environment. Researchers also hypothesize that external factors such as smoking during pregnancies or complication during pregnancies may contribute to children being born with ADHD. Is ADHD treatable? This question is frequently asked by parents of children who have ADHD. They link ADHD with a disorder. Although it is a disorder, it is more common than you would think. ADHD cannot be completely treated. However, alternative methods to assist ADHD are combinations of behavioral therapy, parent education, and medication of different sorts. Who is more likely to have ADHD? Boys are about 3 times more likely than girls to be diagnosed with ADHD, though this is not yet understood why. All kids have trouble focusing and paying attention, particularly when they're anxious or excited. But isn't that how all kids are? The difference with ADHD is that symptoms are present over a longer period of time and happen in different settings. They hurt a child's ability to function socially, academically, and at home. Have you ever tried doing homework or listened to a lecture and you just can't get yourself to pay attention? Here are some symptoms of inattentive ADHD. 1. Trouble paying attention to details. Tendency to make careless errors in schoolwork or other activities. Difficulty staying focused on tasks. Apparent listening problems. Difficulty following instructions. Organizational problems. Avoidance of tasks that require mental effort, tendency to lose things like toys, notebooks, or homework, easily distracted, and forgetfulness in daily activities. Do you find yourself having trouble sitting still throughout the day or always having to move? Here are some symptoms of hyperactive impulse ADHD. Fidgeting or squirming, difficulty remaining seated, excessive running around or climbing on things, difficulty playing quietly, excessive talking, blurting out mid-sentence, difficulty waiting for a turn or standing in line, and interrupting or intruding. When children hear that they have ADHD, they suddenly think that there's something wrong with them. ADHD is something you should not be ashamed of, considering a lot of humans have it today. Because there's no test that can 100% detect ADHD, a diagnosis depends on a complete evaluation. These evaluations are made by primary doctors including pediatricians, psychiatrists, psychologists, and neurologists. Are there certain parts of the brain that may be involved? Experts have found that certain areas of the brain are about 5 to 10% smaller in size and activity in kids with ADHD. Chemical changes in the brain also have been found. The prefrontal cortex is the part of the brain that controls attention, behavior, and judgment. If you have ADHD, researchers propose that regions of the prefrontal cortex may be not functioning properly, causing attention deficit hyperactivity disorder. Researchers' studies have shown that an imbalance in the levels of both dopamine and noradrenaline in the brains of children, adolescents, and adults have to do with ADHD. Researchers also see that deficiencies in glutamate signaling in some regions of the brain may have a moderately role in adults with ADHD. Related problems to ADHD and medication. Children with ADHD can also experience mood disorders, anxiety disorders, and learning disabilities. Some children and adults may ask, can you take medication for ADHD? Yes, you can. Stimulants, a substance that raises levels of psychological or nervous activity in the body. For example, Adderall. Stimulants are the best known treatment for ADHD. Possible side effects include decreased appetite, stomach ache, irritability, and insomnia. Non-stimulants represent a good alternative to stimulants or are sometimes used along with a stimulant to treat ADHD. For example, therapy. Antidepressants can also be a treatment. However, this medication is not recommended for young children. The biggest alternative treatment for ADHD besides medicine is behavioral therapy. What is behavioral therapy? Treatment that helps change potentially self-destructive behaviors. While seeing a therapist, they may suggest a few things to do to change your daily routine to help with your ADHD. Create a routine. Get them organized. Avoid distractions. Limit choices. For example, choose between these two outfits. Use goals and rewards and help them discover a talent. ADHD in the classroom. Here are some helpful things to keep your students on track while teaching. Randomly pick readers so that children have to follow along while reading a passage. Stand close to an inattentive student, touch him or her on the shoulder while teaching. Give simple, concrete instructions. Structure in some guided daydreaming time / small breaks. Help students get organized. Make a structured plan. Spend personal discussion time with individual students and give advice warning when a transaction is about to happen. I hope everyone learned a little bit more about ADHD than they knew. Thank you for watching my presentation.